So welcome back. In today's video we're going to discuss liposuction. Many people assume that liposuction is the answer to all of their body shape problems. There are a significant number of liposuction myths that we're going to dispel in this video towards the end, and we hope to lay out why this is not the case almost ever. And in fact, liposuction is a technique very specifically reserved for a relatively few indications in a relatively few number of patients. To start with, we're going to discuss liposuction, which patients are candidates, the process, and what you can expect from your liposuction surgery. So to start with the different techniques that we use in liposuction, historically we had dry, wet, and tumescent liposuction. These are technical terms which most patients wouldn't necessarily need to worry about, but essentially the modern day liposuction technique involves tumescent liposuction, which is the injection of large volumes of local anesthetic saline, which swells the fatty tissue 2 or 3 times its normal size, which facilitates easy suction of what is essentially a fatty soup. This helps the surgeon, but also helps minimize injury and any damage to the surrounding tissues during surgery. Further options in liposuction surgery are power assisted. Power assistance can come in the method of body jet liposuction. This acts more or less like a jet washer, whereby high pressure saline local anesthetic solution is injected into the fatty tissues, and this is then sucked out, as we mentioned, like a fatty soup. This again causes minimal trauma, makes the surgery less bruised and swollen, makes it slightly easier for the surgeon, and can also speed up the surgery, which is always a good option. A second power-assisted liposuction technique is either laser-assisted or ultrasound-assisted liposuction. Both of these tend to generate heat, which hydrolyzes or disrupts the fatty tissue, then facilitating the sucking out of a fatty soup, as we've described before. Some practitioners suggest that this type of liposuction is better for tightening skin or defining contours in areas where the skin is looser, but there is no evidence in the literature which clearly demonstrates this to be the case. Overall, in my experience, one liposuction technique is broadly similar to any other, and it's best to go to a surgeon who is familiar with the technique that they use and the machinery they have available, and can give you good advice about what liposuction techniques they think would be appropriate for you. In terms of the surgery itself, liposuction can be performed either under local anesthetic or general anesthetic. Many people assume that local anesthetic would be better because it means you can come and go straight after without any associations of being put to sleep. This, in my experience, is not the case. For any liposuction surgical event that requires more than 250 cc's of fat removal, I genuinely believe that local anesthetic is a challenge for most people. The technique feels very much like you're being repeatedly poked with a blunt stick. This in itself is not painful, but it feels rather odd, and most patients tend to get a little bit disquieted and uncomfortable during the procedure. And for me, the last thing that either of us need is you feeling uncomfortable and wanting the procedure to be over as quickly as possible. This is not how we get our best results in cosmetic surgery. By far, the most appropriate targets for liposuction surgery are small deposits of well-defined fatty tissue that are independent of weight loss or gain. The classic story that we like to hear is someone who's been heavier than they are now, but also very slim through gym and exercise, but there's a very specific target on their body which they cannot shift no matter how lean they get. If you imagine a 10k run, not everybody, even the fast runners, are stick thin. There are some funny shapes and sizes, and we put this down to something called lipodystrophy. Lipodystrophy is essentially the storage of fat in very specific places which are particular to you. This atypical fat storage may not be a problem for you, but when it is in a place which stands out, either in clothes or on the beach, then this is a great target for liposuction surgery. In terms of patient choice, ideally we would choose someone who is understanding of the goals, merits and complications of liposuction surgery. We will discuss these in a little bit more detail further on in the video. We would also like to discuss with you if you have any medical problems that would prohibit any type of surgery, any allergies to medication, any medication that would interfere with surgery of any type, but specifically medication that interferes with liposuction are things like blood thinners. And if you are profoundly hypertensive or have high blood pressure or diabetes. As we have mentioned, the ideal liposuction surgery patient is someone who isn't fat but has been thin or is relatively thin and has a very specific target for the surgical treatment. Different areas of the body can be better or worse candidates for liposuction, and I think it's important we discuss this today. To go into detail, targets that include, but not exhaustively, the submental area under the chin. This is a good area for liposuction, which can typically be performed under local anesthetic as a day case procedure. This can give a better defined jawline and neck to those patients who present with a poorly defined jawline, who either genetically or through their own constitution store fat in this area preferentially. Another good area for liposuction is on the male chest. Oftentimes we see young men gain pure fatty tissue behind their nipples, which makes the chest look a little feminine. This is different from gynecomastia treatment, which invariably involves a development of some glandular tissue. But if there is simply fatty tissue behind the nipples, then this is a good candidate for liposuction surgery. This, when it's small and localized, can be performed under local anesthetic, but if it's more generalized or the patient prefers, it's not unusual to perform this type of surgery under general anesthetic, but typically as a day case. One other group of patients which do well with liposuction are ladies with slightly full hips. By hips, I don't mean around the hip bone area, but lateral to the buttocks or a slight fullness of the buttock crease. These ladies can be well targeted with localized liposuction to create a better gluteal fold definition or narrower hips. Slightly less commonly, but either side of the knee can respond reasonably well to liposuction. Also, small, well-defined areas of fatty fullness anywhere on the body can do well with liposuction, even if they're not constitutional, but we often see these in a number of different patients who just so happen to have fatty lumps here and there. Surgical treatment for liposuction involves coming to the hospital, having photos taken and signing consent. The consent is a detailed description of the surgery, what you can expect, what we will do for you during the operation, following the operation, and if any complications occur, and also what complications may arise from your surgery. These complications include unevenness, asymmetry, swelling, especially in the first 2 to 3 months after surgery, numbness, lumpiness, definitely bruising. This is almost invariable after liposuction, although it looks worse than it is. I often joke that performing liposuction is a little bit like mowing the lawn in the dark. We fill up the tissues with saline until everything becomes very swollen. We then do our very best to suck out all of the fatty tissues, but sometimes, occasionally, we leave a little bit behind. This only becomes apparent when the swelling goes down a few weeks later and we see a little bit of unevenness, lumpiness or swelling. If this is significant, then we can consider revision, but in many cases this will improve over time as the swelling continues to improve. Patients will also need a protracted period of compression. What we find is all of the fatty tissue that we remove through suction is replaced by swelling, and this swelling can persist for weeks or even months. Compression tends to squeeze the swelling out of the tissues, a little bit like squeezing a wet sponge, but the compression needs to remain in place for as many hours of the day as possible, for as many weeks as possible following surgery. People often find this a little disappointing, as they would rather go back to their normal lives, go on their summer holiday, put on their bikini or their tight-fitting t-shirts, but this is not how recovery from liposuction typically goes. You will inevitably have scars. These are typically very small and well hidden, but if you go looking for them, you will find 2 to 3 millimeter incisions where we performed the liposuction from. Other complications to bear in mind following liposuction are very rare, but include infection, which can be quite profound. When talking about liposuction in specific areas, liposuction under the chin is only designed to target the fatty tissues between the platysma and the skin. These are the most superficial layers and is the only area safely accessible through liposuction techniques. It will not guaranteedly redefine your chin or neck shape, as it will only target the superficial layers. There is no test to prove whether your fatty tissue is superficial or deep, and so expectations need to be limited. Liposuction to the chest is usually successful, but be aware that older patients who have lost some skin elasticity, there is no guarantee that the skin will spring back. A common problem in this area, but in all areas, is where the skin has lost its elasticity. If we remove the underlying fatty tissue, then the patient can be left with an empty, saggy bag. Signs that this is possible or even likely are patients of advanced age, 40s, 50s and up, patients with stretch marks either after growth spurts or after pregnancy, or patients with clearly inelastic sun or smoke damaged skin. Around the belly button can leave fine crepey wrinkles. The anterior abdomen will often remain a little saggy after liposuction. Typically the love handles and loins do better. The lateral thighs can look a little deflated, and the buttocks can look a little squared off after liposuction to the gluteal fold area. We now get on to some of the myths associated with liposuction, which are very commonly brought to clinic. Patients will ask if liposuction can reduce their weight by a stone or so. This is never the case. Liposuction is not in any way a substitute for generalized weight loss, diet and exercise. The difficulty is that liposuction can only address specific areas of tissue. It cannot debulk an entire area. Patients often ask me if I can make their thighs slimmer or their abdomen much neater or create a six-pack with liposuction. This is almost impossible to do, is highly likely to lead to disappointment with rippling and unevenness, and it is never a good indication for liposuction surgery. This is key, as I hear this request 2 or 3 times every single week. Similarly, we cannot make an entire body part slimmer with liposuction. Patients who come with circumferentially fatty arms, circumferentially fatty legs, or circumferentially fatty knees or calves tend to do very poorly with liposuction, as they are highly likely to be uneven and not neat, svelte and defined after the surgery. We equally cannot change your body shape. If you are an exomorph or an English pear, i.e. overtly round, or carry your weight in a central distribution, then we cannot change that. Equally, we cannot make wide-hipped patients narrow-hipped. Certain areas do very poorly with liposuction. Fat faces, excepting the under the chin area as we've described, do not do well with liposuction, and I strongly recommend this area is avoided. Liposuction to the aging breast invariably creates a deflated appearance which looks noticeably worse. The buttocks themselves should not be liposucked, otherwise you create an emptiness which exacerbates the sag, which is typically more of a problem than the fat itself. As we've mentioned, liposuction to post-pregnancy abdomens or abdomens that have lost their elasticity will almost certainly create an empty, saggy bag, which for many patients is worse looking than a slightly overweight midriff. As you can imagine, many patients, once they have shed the weight in their typically challenged area, think that this means that they will never gain weight in this area again. This means that they go on to gain weight. Unfortunately, some of this weight will invariably go back on the area that we treated, and they will fill up again, creating disappointment. As we've mentioned before, but it's worth reiterating, anywhere where there are stretch marks or clearly loss of elastic skin is a terrible candidate for liposuction surgery. Liposuction will not give you a six-pack. It will give you a more defined area on the anterior abdomen, if that is your area of choice, and with subsequent diet and exercise it will give you the opportunity to look lean and defined. Imagine liposuction is a kickstart to your weight loss process, not an alternative. Liposuction is a terrible technique for cellulite. Cellulite is a combination of inflation of the tissues in an area which has multiple fixed points to the deep fascia. Imagine it's a little bit like a Chesterfield sofa where there's lots of buttons holding the leather to the frame. Liposucking the fatty tissue will create sagging and actually may exacerbate the cellulite. Unfortunately, cellulite is very difficult to treat with or without surgery. There are a number of alternative techniques which we would happily discuss with you, but do not assume that liposuction is the answer to this particularly common problem. Liposuction, as we have briefly touched upon, is terrible as a precursor to going on holiday. The recovery takes much longer than most people think, at the very least 3 months and sometimes 6 months before the swelling goes down and the evenness returns. Please don't think that liposuction in spring will make you summer beach body ready. As we have also stated, compression is an essential part of post-operative liposuction management and will be part of your daily clothing for at least weeks and possibly months after your surgery. Overall, liposuction is an excellent technique, but for nowhere near as many people as would hope it would be ideal for them. It is specifically reserved in my practice for well-localized areas of fatty tissue that do not respond to successful attempts at significant weight loss. This is not to say that people who aren't their perfect weight cannot be candidates for liposuction, but liposuction is never a technique for you to attain your perfect weight. If you have any questions about stubborn fat that you find difficult to move, despite you being at your target weight or being a successful weight loss patient, then please get in touch with us here at Adam Goodwin Surgery. Equally, if you have any questions about whether liposuction would not be ideal for you, then by all means send a picture, send an email, or contact my secretary Charlotte, who would be happy to forward your email to me, and I will give you an honest opinion of what can be achieved.